Good day. My name is Joshua Kembo. I'm Head Demographic Research Division in the BMR. Today I'll be presenting on the topic on trends and changes in population composition, fertility, mortality, migration, population growth, and geographical data in South Africa, as well as implications for planning and addressing the needs of the population. Indeed, evidence-based decision-making has become a vital tool because of its role in ensuring the efficient management of populations, economic, and social affairs. It is in this regard that the triangulated in-depth analysis employed in this presentation takes a close look at population trends, shifts, and dynamics in South Africa. In addition, the in-depth analysis triangulates demographic data mainly from the BMR, from Stats SA, and the United Nations Population Division. The aim of the analysis, therefore, is to provide key trends in key demographic indicators in South Africa to support in planning, monitoring, and evaluation of the implementation of programs and other initiatives in both the private sector and the public sector in the country. Our starting point in this presentation is the population size of South Africa as at mid-year 2022 and as estimated by the BMR. The population size as estimated at mid-year 2022 was 60.6 million persons, and the annual population growth rate was 0.8%. We now look at the trends in the percentage of the adult population, that is persons aged 15 plus in South Africa for the past decade. And we see that there's been a gradual increase in the percentage of this category of the population, rising from about 67% in 2002 to 70% in 2022. As we'll see later on, this has got wide implications for marketers in South Africa. We now look at the sex ratio as we further take a close look at the population structure in South Africa. A sex ratio of above 100 means that there are more males than females in the population. And we see from this figure that there's been a gradual increase of the sex ratios in South Africa, indicating the relative increase in the number of males per 100 females in the population in the country. We see from the population pyramid for South Africa that the South African population is fairly young. As we have noticed before, the adult population is quite significant at 70%. There are also observations of an increasing aging of the population as well. That is, an increasing number of the population aged 60 plus. We now look at fertility as a component of population change. We see that the total fertility rate in South Africa is 2.34 children per woman. This total fertility rate is above the replacement level fertility. Replacement level fertility is the fertility level that is needed for each generation to exactly replace itself without needing international immigration. A value of below 2.1 will cause the national population to decline. If we look at the trends in fertility in South Africa from 2002, we notice that fertility as a component of population change has been the main driver behind the slowing of the population growth in the country. We now look at life expectancy data in South Africa, and we see that there is a 6-year difference in life expectancy between females and males, with females expected to live about 66 years as compared to the 60 years associated with the male counterparts. And for both sexes, we see a life expectancy of 63 years. Ladies and gentlemen, the life expectancy at birth is the average number of years that a newborn in South Africa is expected to live. We see from this data that there's been a general improvement in life expectancy in South Africa. However, we notice a slight dip in life expectancy over the 2 to 3 years associated with the COVID era. But generally, throughout the trend from 2002 to 2022, we see a general increase in life expectancy in the country. Looking at the estimated trends in migration streams from 2006 up to 2021, we notice that Gauteng province in the country has been the most receiving province of migrants, followed by the Western Cape and Northwest, as well as Mpumalanga, and lastly, Northern Cape. On the contrary, Eastern Cape has been the most province where the migrants have originated from, and also followed by Limpopo, as well as KwaZulu-Natal and Free State. This slide gives interesting data on population growth rates by selected age groups. We notice 3 key aspects, the first of which is that population growth rates have been generally on the decrease. And then number 2, the population growth rates associated with young people, and particularly over the last 3 years, have been on the increase. A similar trend is also observed for population growth rates for the aged population, that is the population aged 60 plus. We now examine further data on mortality. And first, we look at infant mortality. Infant mortality is associated with the deaths of children under 1 year old. And when we look at this data, we see that the infant mortality rate in South Africa of 55 deaths per 1,000 live births in 2002 has been on a sharp decline over the number of years, leading to 24.3 deaths per 1,000 live births in 2022. Similar to the infant mortality rate is the under 5 mortality rate, and this measure measures the number of deaths among children aged below 5 years. And we see that also the under 5 mortality rate has been on a sharp decline, taking a similar shape to the infant mortality rate that we have observed in the previous slide. The unmet need for contraception currently stands at 14.1%, indicating that more than 1 in 10 women have their need for contraception unmet. Indeed, family planning is a human right, and from a human right perspective, the unmet need for contraception should ideally be at 0%. Having looked at the population size and structure, as well as the components of population change, that is fertility, mortality, and migration trends, we now look at the implications of the hard population figures for planning. We note at first that there are notable macroeconomic implications that can be drawn from the analysis we have presented regarding the current state of the demographic transition. The issues indeed that arise pertain to the following. 1. What is the state of the demographic dividend at the moment in South Africa? And secondly, are there significant levels of aging in the population that could have implications for service and product demand? The data has clearly shown that South Africa has a large proportion of the adult population, and we saw that currently stands at 70%. And that could have lots of benefits with respect to consumption and expenditures. And for the marketers, there is a huge potential in the large proportion of the adult population, as well as the aged population, that is, those aged 60 plus. A number of countries have had an economic boom when they've reached the demographic dividend. For instance, Thailand and other East Asian countries successfully capitalized on the shifts in their age structures in order to gain a boost in economic productivity, that is the demographic dividend. A country with both increasing numbers of young people and declining fertility has the potential to reach the demographic dividend, that is the boost in economic productivity that happens when there are growing numbers of people in the workforce relative to the number of dependents. The potential for economic gains can be huge, provided that the right policies are in place and investments in human capital, particularly among young people, are substantial and strategic. In South Africa, however, the challenge remains that because of the high poverty and high unemployment, the country cannot capitalize on the demographic dividends. In support of a skilled population, studies by Lutz and others have clearly shown that the demographic dividend can only be of benefit to the country if the population is skilled. In fact, Lutz and others add that education rather than age structure brings about demographic dividend. They further state that for a country to experience the demographic dividend, it must ensure that people are trained first in vocational and second in entrepreneurial skills. If people are not being trained in vocational and entrepreneurial skills, the country will not realize that benefit, because instead of being job creators via entrepreneurial skills, the people become job consumers. As we conclude, it can be stated that it is to the benefit of the country that the fertility rates in South Africa have been on the decline. This implies that the dependence ratio declines as the proportion of the population aged 0 to 14 years becomes less, as there are more people entering the labor market as labor supply. In addition, there are significant levels of aging in the South African population. About 8.1% of the population, that is 4.9 million, is aged 60 years and above. This segment of the population has been gradually increasing over the past decades. This points to a potential for marketers with respect to increasing service and product demand specific to this segment of the population.